I'm Tammi Nander. A few years ago, I contemplated suicide. Outside of my hospital, a sign read, "Heroes work here." Inside the hospital, I was standing in front of an Omnicell machine, deciding whether to bolus myself with potassium or insulin. Depressed, I had lost count of how many horrible COVID deaths I had witnessed. My back hurt from the injury I sustained from a panicking patient.
Excuse me, it's really hard to hear you,
Okay.
so close to the mic, speak,
Sure.
even though it's testimony.
Sure. But depression and pain doesn't automatically drive someone to a death plan. What pushed me over the edge that day was the bullying I had endured from my manager. My manager told me she was short-staffed and needed me to pass medications. I felt guilty and decided to go in and be mindful of my work restrictions. But by 3 p.m., my back was stinging in pain, and I told my manager the work required me to perform outside of my orders and was unsafe, so I went home. Again, she assigned me the task, and when I said no for my own safety, she called saying that she spoke with HR, who said it was fine for me to work outside of those orders, and if I refused, I would lose my workers' comp benefits. So I emailed HR and my manager, asking what doctor they spoke with to clear me for that work. Within minutes, she withdrew her demands. But the next shift, the director of nursing presented me with several write-ups for absences backdated over a month for the days I called out and was admitted to the hospital for the work injuries. After that, my manager and director actively intimidated me at work. HR refused to help, and I realized I had no allies. I filed an OSHA complaint for retaliation. Then management was much more careful about how they bullied me. My manager put me in unsafe situations. She hovered over me, watching closely. She questioned my competence in front of patients. I dreaded every shift, I cried often, and I hardly slept. OSHA would take months to intervene, and I no longer had the mental battery or focus to advocate for myself, and I was giving up. I can't remember why I decided not to pull the medications and carry out my death plan, but after I did, I quit that job and started travel nursing until I had my son. Although I faced death daily, my mental health improved just enough to keep me safe after I left that environment. Now I work to help healthcare workers. The stories they tell me scare me for them. Nurses have a high risk for suicide. We're smart enough to know how to die efficiently. We have access to all of the supplies. We know exactly what to say, not to get Baker acted. And our mental health is assaulted nearly every shift. Hospitals have never treated us like heroes. They hardly treat us like humans. You will continue to hemorrhage healthcare workers unless you do something about this. So if you truly feel that healthcare workers are heroes, then your decision is easy today, and you will favor H 1882, the Workplace Psychological Safety Act.
Thank you very much.